Good afternoon, and thanks so much for joining in. We've now finalized the remaining allocations of the state's coronavirus relief funds, and we'll exhaust the entire $1.25 billion allotted to our state by the federal government's December 30th, 2020 deadline. Well, $1.25 billion is a significant sum of money. The pandemic and its related financial impacts have drawn on these funds for nearly 9 months now. Those impacts have been great enough to exhaust the entire coronavirus relief fund, and yet that's still not enough to offset every financial loss that we've seen throughout this state. To recap how the money was spent, I'll start by sharing a high-level overview. Over $833 million of the dollars went to over 24 grant programs that directly support businesses, schools, nonprofits, individuals, and government entities. The most in demand of the programs was the business stabilization grants, in which we allocated $254 million and offered a total of 3 rounds to provide working capital for up to 9 months of the year. Other programs include business innovation and business adaptability, loan deferment, agriculture adaptability, Montana meat processing, and live entertainment and movie theater grants. They also include food bank and food pantry grants, social services nonprofit grants, tourism and census outreach, emergency housing, and telework assistance. We also provided 2 rounds of funding to local public health and tribal health departments and established a reimbursement program for local governments. As you may know, the original allocation of the local government program was estimated to be at $300 million. The total amount allocated to local governments will be less than the $300 million anticipated earlier in the year and will be closer to $200 million. Because local governments have already been made whole, and local governments were not on track to spend the entire $300 million, we redirected the leftover funding to ensure its use by the end of the December 30th deadline. The original $300 million also took into account the possibility that the federal government would actually allow the funds to be used for revenue replacement, but that never came to fruition. Leftover funding is going directly to Montana citizens and businesses suffering from the impacts of the pandemic. Local governments will still receive reimbursements in a final round for expenses that have a direct or substantial nexus to COVID-19 relief. Local public health costs, as well as costs associated with the enforcement of health ordinances, will still be covered. Only difference is that the final local government round will not cover presumptively eligible personnel costs that were already budgeted for in local government budgets prior to the start of the pandemic. And at the end of it all, local governments will still be among the top recipients of coronavirus relief funding. The other $417 million of the $1.25 billion in coronavirus relief funds was allocated through non-grant programs. It includes over $30 million for the Montana University System for testing, contact tracing, quarantine efforts, and mental health services. Also includes over $254 million used to enhance unemployment insurance over these 9 months. The bulk of that was for the Unemployment Insurance Trust Fund. Other costs included covering COVID-19 related state services, including testing, PPE, additional nursing and surge capacity, and other applicable state agency reimbursements. In many ways, I'm certainly pleased at how we prioritize this funding for all Montanans. Funding to the Montanans, to the businesses and the nonprofits who needed it most. We established 25 unique and targeted grant programs that made available opportunity for more than 14,000 businesses of all sizes for every school district in the state, child care facilities, individuals, nonprofits, and local governments to apply for funding to help weather these challenging months. Many of our state agencies went above and beyond, reallocating existing staff and hiring more staff, working longer hours to review and approve tens of thousands of grant applications and ensure that the funding went into the pockets of qualified and in need Montana citizens and businesses. In particular, the Montana Department of Commerce worked diligently to award hundreds of millions of dollars to the most in-demand grant program, the Business Stabilization Grants. At some points, the Department of Commerce was awarding the same number of grants in a day that it typically does in an entire year. And the department set up a transparency dashboard, making us one of few states that actually shows how every dollar is supporting awardees in all 56 counties. Among the non-grant allocations of the CARES funds, we're supporting the health and economic resources necessary to ensure that we can continue tackling this virus in our communities. We provided funding to our Montana University system, private and tribal colleges for testing and to carry out contact tracing and quarantining to keep as many students as safe as possible while conducting a fall semester on campus. We've ensured that resources from other federal grant sources are available to continue funding testing beyond this December 30th deadline into the new year. We also provided funding to ensure that our healthcare facilities have enough supplies of personal protective equipment and to bring additional healthcare workers to assist our strained hospitals. By boosting the Unemployment Insurance Trust Fund, we're providing significant relief for 43,000 businesses who would have otherwise experienced an 85% or greater spike in their tax rates. Montanans on unemployment due to COVID-19 will receive an additional $200 per week in enhanced unemployment benefits during this holiday season. And we're among just a handful of states that made sure that unemployed Montanans received the full $400 per week during the FEMA Lost Wages Assistance Program. With all this and more, the coronavirus relief funds have served our communities throughout these trying times, keeping the lights on at businesses and employees at the job, helping those without work pay their rent, making sure that our local government budgets were made whole, and guiding us through continued public health challenges. As the Coronavirus Relief Fund nears its end, here at the state, we'll fulfill our responsibility to the public in spending wisely this money and spending the money in full by the federal deadline. We want to make sure that the state will not have to return unspent funds to the federal government, nor have clawbacks from the federal governments or liabilities for deploying funds inconsistent with the federal requirements. However, the pandemic continues on, and with it, the financial and health impacts in all corners of our state. And it'll continue long beyond the federal government's December 30th deadline of the CARES Act. Further congressional action is needed to provide states with financial support to assist individuals, businesses, and governments across our country in the new year. As it stands now, states and their citizens risk having to navigate a pandemic, now in its third and highest wave, without any federal relief. I again urge Congress to put politics aside, come to the table to reach an agreement on a much-needed further relief. States have waited far too long for another round of support and had to do so with much uncertainty, making it difficult to plan for future responses. This is a storm that cannot be weathered without federal support, particularly as the current relief package passed nearly 9 months ago is soon expiring. As the pandemic continues on, we continue to work through challenges with rising caseloads and hospitals stretched thin. think it was last week I announced a new partnership with Talent Solution New West Group to assist with filling the gaps in healthcare worker shortages at our hospitals in Montana. As of yesterday morning, 229 medical staff from around the country are deployed in Montana as frontline healthcare workers. When healthcare workers have to care for more COVID-19 patients in our healthcare facilities, those workers are at greater risk of contracting the virus, placing them in isolation or quarantine and temporarily out of the workforce. We're greatly appreciative of these contracted registered nurses and respiratory therapists who've committed to serving patients in our ICU wings and healthcare facilities until the end of this calendar year. Many are serving at Benefits Health System, Billings Clinic, Bozeman Health, Kalispell Regional Medical Center, Providence St. Patrick Hospital, and St. Vincent Healthcare. Others are also at Community Medical Center, Great Falls Clinic, Holy Rosary Healthcare, Livingston Healthcare, Northern Montana Hospital, St. James Healthcare, and St. Peter's Healthcare. Additionally, the New West contracted medical staff will assist with the staffing of alternative care sites. Kalispell Regional Healthcare is in the process of making operational the alternative care site that was built on the vacant third floor of the Montana Children's Facility there this spring. 50 beds will be prepared for use by non-COVID-19 related patients, freeing up space for COVID-19 patients in a separate isolated area should there be a surge. We had requested a total of 278 contracted medical staff to serve Montana and anticipate that more will continue to arrive in the coming days and weeks. With the rise in cases now stretching across our entire nation, we're again seeing some delay time in testing results, though not nearly as bad as we experienced this summer with the second wave that hit other parts of the nation. Our out-of-state contractor, Mako, experienced some delay time with increasing volume nationwide as cases spiked across the country, but has since increased staffing and capacity. We're already seeing improvements. Here in Montana, we've worked hard to build up our in-state testing capacity. Still have turnaround times of about 1 to 3 days from when the sample arrives in the lab. State lab is currently able to process 1,300 tests every day, 7 days a week. On days where testing numbers exceed 1,300 at the state lab, the excess test samples are sent to Mako in North Carolina. Montana State University has the ability to process between 1,500 and 2,000 tests a day. University of Montana can now process 500 a day. The state's also supporting testing at Kalispell Regional Medical Hospital, Bozeman Health and Billings Clinic. These sites can process between 500 and 1,000 a day. In the past 4 weeks, we performed a total of 146,975 tests for a positivity rate around 18%, as testing remains targeted principally to those that are symptomatic or close contacts of known positives. We recognize we need to further ramp up testing capacity right here at home. Our geography, both being far from out-of-state contractors, often on the East Coast, and Montana just being as large a state as it is itself, does create some unique challenges in reducing the wait times for results. We're currently exploring possibilities for further building in-state capacity through a regional approach so that we can minimize the travel time of samples that need to travel long distances in our state. Keep you apprised as we work on developing those partnerships that'll continue to build on Montana solutions to sort of the unique testing challenges. Montanans can and must play an important role in supporting our doctors and nurses as we continue to navigate through this virus and the continued challenges it presents in our communities. The additional medical staff who traveled from across the country to assist our state deserve our support. And so do all the frontline healthcare workers here at home who've been working tirelessly for 9 months to provide the best care possible. The providers administering tests and the lab technicians running those tests deserve our support too, as do local public health officers and staff who are committing long hours to try to keep up with contact tracing work and other community measures to keep us safe. We need every Montanan to stay home as much as possible, wear masks when in public spaces, social distance, and avoid large gatherings. These are basic preventative measures that can give those doctors and nurses a chance to take a breath at the end of a long shift. These are basic measures that can ensure that fellow Montanans receive test results back in a timely manner or can access a test when they've had a close contact to a known positive. This is the reality that we must continue to live with until there's a widely distributed vaccine. That time will come, but until then, Montanans need to stay true to our neighborly spirit of looking out for others in challenging times. And we are inching closer to when a widely distributed vaccine will be available. Earlier this week, participated in a briefing with the nation's governors, the Vice President, and the White House Coronavirus Task Force on the news that we could see the beginning of initial early-stage distributions of vaccines in mid-December. We've been working for many months on developing a plan for what the distribution may look like, and in October, Montana released its initial COVID-19 vaccination plan. The vaccination plan really is a work in progress or a work in motion as we move forward and as more information becomes known in the coming literally days, weeks, and months. At this time, there's a whole bunch of moving parts. To connect the various moving parts, the Department of Public Health and Human Services has formed a COVID-19 vaccination coordination team. The team includes about 60 individuals representing about that many organizations across our state. First meeting was held on December 23rd. We also have an internal team of experts who are meeting regularly. Just as COVID-19 has impacted people across Montana, so too will the vaccine distribution and administration. First meeting of the vaccine team provided a chance for an exchange of information both from the state health department and from stakeholders on the call. This team of community leaders and representatives from all across our state has already been invaluable as they raise critical questions and provide feedback and guidance as we turn our planning into action once vaccines are approved. New information from the federal government becomes known literally every single day. There are things we know at this time and many that we still do not. For example, the National Advisory Committee on Immunization Practices, or the ACIP, held an emergency meeting yesterday regarding recommendations for the allocations of vaccine supplies for Phase 1A, which is the very first allocation of vaccine. This is an independent federal advisory committee of medical and public health experts that provides advice and guidance to the Center for Disease Control on vaccine-preventable diseases in the U.S. They represent effectively the gold standard of immunization ethics and policies. In the yesterday meeting, the advisory committee expressed the goal of maximizing vaccine benefit and reducing harm. The committee voted yesterday to recommend that initial vaccine doses, when approved, should be offered to healthcare personnel and residents of long-term care facilities. These recommendations now then go to the CDC director for final approval. We also know that the initial first shipments of the vaccine could arrive as soon as December 15th or December 16th. While we don't know the exact number, we expect I've been told about 9,750 doses of the Pfizer vaccine. And then we'll likely be receiving several thousand more doses in subsequent weeks. The second vaccine pending approval is the Moderna vaccine. If the federal guidelines remain the same, the first shipment of that would come out about a week later. At this point, we don't know how many doses that we'll initially receive, and we'll certainly share that information once we know more. Vaccine will enter the state in various ways. The state allocation will be directly, on the one hand, channeled through the Department of Public Health and Human Services, which will be working with partners around the state, principally with the Pfizer vaccine, those that have capacity for cold storage. As part of that state allocation to the federal government, then has been working directly with CVS, Walgreens, and in Montana, Big Sky Pharmacy, to administer the vaccine in long-term care facilities. Then there's a separate allocation for federal organizations such as the Indian Health Services and the Veterans Administration. CDC asked Montana tribes to elect whether they wish to receive their vaccine allocation from the state or federal sources. To ensure a fair and equitable distribution, Montana will be guided by the ACIP recommendations. As for the state allocation, the Department of Public Health and Human Services has been working to enroll and will be providing training to enrolled providers regarding COVID-19 vaccine storage, handling, and administration based on both federal recommendations, best practices, and vaccine manufacturer product guidelines. These are largely the same providers who participate in vaccine programs year-round, so they're familiar with the process. But the COVID-19 vaccines do add a level of complexity. So we'll be making sure that before providers receive the vaccine, they have the information they need to conduct this important work. While we're still finalizing numbers and the distribution process for mid-December, focus for that first allotment will be on the vaccination of healthcare workers. We continue to work on various other logistics and will continue to provide updates. We're also in the process of creating a frequently asked questions document that will be posted online, among other related information. I'll now open up for questions, and in addition, there are Dr. Holzman and Jim Murphy here if there's any questions for them. If you'd like to ask a question, you can press 5*. You'll be notified that your hand is raised. When we unmute your phone, you'll be notified that you've been called on to ask your question. First phone question.
Hey, Governor, this is Holly Michaels. How are you doing?
I'm well, Holly.
Good. I have two questions. The first one is I'm wondering if you have an estimate of what the healthcare worker population is, and I guess for long-term care facilities too, just how many people fit those two groups in Montana, and then wondering with the, I think you said 9,750 doses of the Pfizer vaccine, then more in subsequent weeks. Would we divide that number by two for like the two shots that each person would need, or just wanted to better understand what that amount means in terms of doses per person?
Sure. So the estimate, healthcare workers broadly defined as somewhere between 45 and 60,000 in Montana. And certainly, like with all Montanans, when they have the opportunity and the availability, would encourage them to take a vaccine. But certainly those healthcare workers will have to opt in or provide consent to get the vaccination. As far as I've now forgotten, Jim, the population in senior and long-term care facilities? Staff and residents, the estimate is around 10,000. The 9,700 that come from Pfizer, hopefully on December 16th, that doesn't have to be cut in half. So the Pfizer vaccination is you have to get it twice, right? The first time and then 28 days later? Is it 28 or 21? One of them's 21, one of them's 28 days. But what was told by General Perna, who's the head of sort of the distribution, is that we can anticipate the follow-on for that first 9,750. 3 or 4 weeks later, whatever's consistent with what the drug manufacturer's requirements are. I assume that will be the same case, the same with Moderna as well. I mean, the number of vaccinations we'll receive, assuming Moderna gets its emergency use authorization, has been a moving target even as of today. So not quite as much clarity yet on what will happen with Moderna.
Okay, and then the last thing I wanted to ask is what other conversations that you have had, or that group of 60 that's working on Montana's vaccine rollout with the incoming administration. Just it seems like this is going to be handed off right as we're in the middle of this, if everything, timing kind of goes as it seems it is now. So just wondering what communication's been like there.
Well, I think that the incoming administration did have a meeting about 2 weeks ago with a lot of sort of my crew or the current crew, and that's everybody from the state medical officer to folks from the Department of Public Health and Human Services, and General Quinn kind of giving them an overview as far as what the vaccine distribution. I've not had any direct conversations with them. And we've been working on getting all this set up. And again, it will be in some respects, one is hopeful that, this initial allocation is pretty darn small. It's based on population. That's just what the availability of Pfizer has. But the hope and the expectation is as we roll into 2021 that additional supplies in a greater level will be received. And just as the vaccination plan sort of that's already put out, has here are tiers, ACIP will have the same of the sort of 1A tier, 1B, and subsequent tiers, and anticipate that Montana, like most states, will be following, by and large, the ACIP guidelines.
Thank you.
Yep. Next phone question.
Hi, Governor Bullock. This is Maritza Georgia with NBC Montana. I'm wondering, I was on the task force meeting a couple weeks ago about the vaccine distribution plan at that point. Based on your meeting this week with the other governors and the vice president, does it seem like we are on track for more widespread vaccine distribution by like May or June of next year? So,
Maritza, I mean, that's where, from a day-to-day basis, literally Monday they said that we could anticipate that first round from Moderna being 2,000 doses. Now they're saying potentially significantly more than that, to the 15 to 20,000. The estimates that we have received, and these are the targets, was that by the end of this calendar year, up to 30,000 doses, 30,000 in total individuals might be able to be vaccinated. But there really isn't, and look, this hasn't even gotten the emergency use authorization. We anticipate that by December 15th. But there is not a lot more daylight into exactly what will be happening come March, April, and beyond that. As I think I've said many times over the last 9 months, that this has been a sort of rapidly changing and evolving situation, and kind of getting that daylight and clarity from the federal government has been certainly the same. But I guess, yeah, and I'd only add on that the good work and the good groundwork that's being done I think, we're asking our public health to be providing information to healthcare providers on the best way to both store and administer a vaccine where the guidance hasn't even fully come out at the federal level by any measure. So it's all very compressed, but I have the comfort level both in our team here that the information that they'll provide is correct and that the groundwork, the base infrastructure, the plan for vaccine distribution, it's not without, significant complexity over a state of 147,000 square miles. But I think that they're doing a great job in saying, here are all the building blocks, and we'll be ready to go when we receive the vaccines. Next phone question.
Governor Bullock, this is Kevin Trublin with Yellowstone Public Radio. Thanks for holding this call. Back on the topic of COVID relief funding, when you say local governments are already made whole, can you explain what you mean by that, please? And does that mean they're already covered for all of their COVID-19 related costs?
Well, I think that local governments is an example, like let's use a law enforcement agency. That federal guidance had come out that said that you could use CARES Act dollars for salaries and benefits of a sheriff's department. Well, those are already budgeted items along the way. They weren't additional costs as it relates to the global pandemic. So probably 90 to 95% of the money that local governments have received were for items that were already budgeted. So they were already had planned to pay for. So that's what I mean by being made whole. Now, if there are additional costs in the next couple of months, if they're paying for additional contact tracers, for things that are directly related to COVID-19, not just directly related to the regular administration of government, which they would have had to do even without this global pandemic, we'll still have the ability to pick those things up.
Zach Kaplan, ABC Fox Montana. With regard to the pandemic going forward, as well as vaccine distribution, how much public input has there been towards your team's decision-making process, as well as the panel that you mentioned that's kind of looking into the rural distribution? How much public input has there been to that regard?
As far as for whom?
As far as some of the potential issues that may pop up.
I guess I'm not sure. So are you saying from a public input, like public comments on who should get the vaccine or where it should go, or
more so on the potential problems that could pop up? What kind of public input are you getting in terms of concerns to that nature?
Jim, do you want to? Okay, yeah.
On too, because we work very closely together, but work in different areas too. Just to give an example from that, with the hospitals and the aspects of the challenges that they've had now with the capacity and issues that are going on there, we are meeting with the PPS hospitals in the morning, every morning, and kind of going over there. There's been a few of the chief medical officers that they've put forward, and we're meeting twice a week in the evenings to kind of go over and discuss topics that would be coming forward and get input that they can go back to their people and bring that forward. So this has come up on the distribution of medications, some of the new monoclonal antibodies that have come out, and how that is going to be distributed and how to do that the most fairly with the limited supply. We've brought the issues of the vaccination and aspects like that have been coming up. They've also helping us out by doing surveys within their own facilities to find out what percentage of their providers want the vaccine when it first comes out. So those things have gone on. We've had other areas where crisis care standards of care that we've met with other groups, including not only providers, but ethicists and others to come forward and work on documents together. Serge, it's just been different in different groups, but we always appreciate everyone's input and learning from them and getting an ideas of what's actually happening on the ground floor. I don't know if Jim wants to add more.
I guess the only comment I would make to add to what's already been said is that when the pandemic began, we received an awful lot of concerns and questions from the general public. Both came through the Joint Information Center at Disaster Emergency Services. A lot of them came directly to the state health department. A lot of them came to us through the local health departments. That helped shape a lot of the messaging and a lot of the protocols that are out there. At this point, we get a lot less of those because we're a little further into the epidemic. But we still get our fair share of questions around testing, around isolation, quarantine. We use those to try to guide a lot of the public messaging that is done through the Joint Information Center and with the public health departments to try to answer what seem to be the common questions coming up. I think as we move into the vaccine phase of this response, it's going to be very important for us to be responsive to the concerns that get raised from healthcare providers, from vaccine recipients. We're already getting a few questions about, what's going to be required, what's not going to be required. We're working through a lot of those. That's going to help us shape the messaging and figure out what kind of concerns need to be addressed as we move forward with hopefully a successful vaccination campaign. So I think the input of the public, a lot of it comes in through active participation as they hit us with emails or they call our hotlines or otherwise kind of voice concerns to us. We do have good representation on the group that is advising on the vaccine plans for Montana. There's a lot of partners in that. They have a large constituency out there, so I'm sure we'll hear a lot of input through that process as well, and we look forward to that.
Yeah, I'm sorry, I was just a little confused. Next phone question.
Hi, this is Phil from Great Falls Tribune.
Hi, Phil.
I was just wondering if the flu's arrived, if it's causing any complications, or in terms of fighting the coronavirus now, if you're getting a lot of flu cases coming in, and didn't know if that's had any kind of impact.
In response to influenza, we still, to my knowledge, have not had a laboratory confirmed influenza case identified, and that's great news. We're getting pretty much mid-November is when we typically have those, but it's happened later than that. We are optimistic that maybe some of the control measures that are in place for COVID are going to benefit us for influenza season too. If you think about a lot of the practices we're doing, from hygiene to work at home to mask use, staying home when you're sick, all of these things are things we routinely advise for influenza control. So public health folks and healthcare providers are optimistic that we might have a more mild flu season because of some of these measures and some of the precautions that the general public and others are taking to help keep our flu numbers down. As always, we are concerned that when flu does start to arrive in Montana, it's going to stress systems that are already stressed responding to COVID. And that's still a concern we have. But right now, we're still fortunate. We have not seen confirmed influenza cases in Montana.
Next phone question.
Hi, Governor. This is Chad Sokol in Kalispell. When we talk about needing more aid from Congress, there's been a lot of hand-wringing over, the amount that they should approve in a new package. And so I guess that's my first question is, do the states need some aid now and, we could revisit it later, or do you think the amount in the next package is important? And on top of that, since we are moving into the vaccine distribution phase, does the form of the assistance need to be adjusted a little bit so that it can be spent on new types of response measures?
Well, I think, Chad, I mean, this has been a discussion that's been going on now for 9 months. And any additional opportunities, as example for unemployment insurance, expires December 30th. When you look at not just in Montana, but around the country, what has sustained both communities and other areas during what's been the biggest public health challenge of our country in a century, what's helped sustain what also became the largest economic challenge in a century was some of the things like the dollars for business stabilization grants or the money to provide so that schools could safely reopen. And when the chair of the Federal Reserve basically says, you know, more money, not less, will be helpful, as opposed to even focusing on what the dollar amounts are at the end of the day, the recognition that, by and large, like we've carved out through grant programs, the opportunity to continue to pay for testing for the first several months of 2021. But the assistance and additional dollars for everything from testing or aid to our K-12 schools, our universities, all of that is gone as of the end of this year. So I think that there really does have to be a concentrated focus, and that's not even addressing what many states have had to deal with of significant loss of revenues. As noted before, we're in a lot better position than most states, but at some point you're going to be cutting essential services. I don't know that you have to necessarily, like there was a proposal that came out among both some Democratic and Republican members yesterday. You don't have to solve everything, but you can't, just the notion of inaction is insufficient. And when it comes to, as we move to a different phase of vaccination, I mean, we've got to make sure that we can fund the infrastructure for vaccination, but we're still going to be dealing with both the economic impacts and the health impacts beyond a March or April or when vaccines are widely distributed.
Are you optimistic that the pace or the tenor of those negotiations will change with the new administration?
I sure hope so. I mean, look, I was optimistic 3 months ago that D.C. would get its act together and actually get something done back then. So I do hope that, like, I'd love to see something done before the end of this year. But I am optimistic that Democrats and Republicans have recognized that this pandemic hasn't gone away and that there are significant needs, and businesses are hurting, individuals are hurting, and we have to be funding the infrastructure to deal with this pandemic.
Governor Bullock, John Riley, MTN News. I've got two questions. The first being in regards to CARES Act funding. The state was using that to help cover the costs of National Guard deployments, who have been incredibly beneficial to response. Is there any look at dipping into state funds if that relief doesn't come?
So, a couple of different things. Right now, and that's one of the things that universally that the governors have asked for the Trump administration to extend the time for which we can actually use our National Guard soldiers for under federally activated emergency. And I mean, Democrats and Republicans are saying that, look, we're relying on our soldiers and our airmen in so many different ways. So I'm certainly hopeful that that they will act on that and act on it by the time that it expires, which I think is like the first week of January. So, and you know, we'll have to cross that bridge when it comes. Now, the challenge, candidly, would be if all the CARES Act dollars, which by law, unless they change, if it's not spent by December 30th, it reverts to the federal government. That's one of the reasons why we wanted to make sure that that money was wisely spent. but there wouldn't necessarily be a pool of money to pay for the National Guard on state active duty. That would be something that presumably the next legislature would have to deal with.
And then my other question, as you mentioned, with potential distribution of vaccines, we're looking at several months, if not half a year, before we reach those goals. Montana also just had its deadliest month for COVID, more than 300 dead. What can we do right now to curb that?
Wear the damn mask. I mean, stay home. That's the challenge is, and look, and we're not unique in as much as that, I think I saw that 95% of jurisdictions in this country have seen an increase over the last 2 weeks. So it's going up everywhere. But exactly, there's reason for real optimism with the vaccine coming out. But to your point, it's not going to be widely distributed for some time. And we have to continue to take preventative and protective measures to try to limit the spread of this virus, because it is all throughout our state in community spread.
No consideration of lockdown or fines?
2 weeks ago we put additional restrictions in, and I think by and large that folks are complying with that. I mean, as far as fines and I don't even know, like fining people for not wearing masks, is that the?
I believe that was a record for a point that was brought up by the federal government or the briefing of the governors.
There was nothing in our call, but it is one where, look, we expect Montanans to take it seriously. Another phone question.
Hi, Governor Bullock. It's Maritza again, and I had one more follow-up, if that's okay.
Yeah, you do.
Just wondering, you talked about working with state partners that have capacity for cold storage for that Pfizer vaccine. Are you able to elaborate on which state partners have that capacity at this point?
So there are, when we talk about state partners who would have capacity for cold storage, looking at hospitals in most of our larger communities that would have that capacity. So we're working with them whether that should be more or less where they're shipped to instead of the Department of Public Health and Human Services. Now, there's remains some ambiguity even as of today of how long the Pfizer vaccine can either be outside of cold storage. So we're trying to figure all of that out with what is somewhat a moving target, unless you have something else to add, Jim. Even as of like this week, we've been having both surveying and having discussions with the hospitals to test and understand all of their cold storage capacity. Not at all? Well, as we get closer to what hopefully will be a December 16th arrival of vaccines, we will certainly provide additional updates, and we hope to have a frequently asked questions document put together on the website soon. And again, just would encourage people to recognize that the actions that we take, even without a vaccine, are what will limit the further spread and transmission of this virus, what will make it easier so that hospitals aren't stressing their capacity, and it'll make it much more likely that we can make it through December without having another record month for deaths. Thanks so much.